Hi, I'm Dr. Christian Thomas. I'm one of the medical oncologists at New England Cancer Specialists, independent oncology practice in Westbrook, Maine. I am a solid tumor oncologist with an interest in molecular medicine, precision medicine, and I also am the director of clinical research. Precision medicine really means that with the latest technology, we're able to define the target in a person's tumor much more accurately. When we can define a target better, that means we can come up with a treatment that hits that target very precisely. Typically, what that means for patients is that we have a higher chance of controlling that cancer or getting rid of it even. And at the same time, typically side effects are better. The difference here with precision medicine is that a lot of those side effects can be avoided by using a medication that is much more precisely targeted to a particular cancer. We now can use a DNA analysis of each patient's individual tumor to analyze it. And what that means is that every tumor is as different as every patient is, like a fingerprint. And with DNA technology, we can fingerprint a tumor. And at that point in time, we get a whole list of different parameters that we can use to help devise a very specific treatment for that particular patient. So if we don't find a target today, we might find one tomorrow with this particular technology, because research changes so quickly that we sometimes within days or weeks or a few months can help patients that we couldn't help before. At New England Cancer Specialists, we have access to all the testing labs. And the reason why we do that is because this technology changes very quickly. And so it is important to keep tabs on that. We are also working with a national alliance of other cancer practices, and we're constantly exchanging data. That helps us to try to figure out what the best treatment is for any particular patient. And I think as a patient, what you should try to remember is when you are faced with a diagnosis of cancer, that this is a technology that should be made available to you. It is available, and it is particularly available in places that do research like New England Cancer Specialists. But patients need to also be mindful that it doesn't hurt to ask. It doesn't hurt to say to the doctor, is this a test that could potentially help me in my case?